Hello, everyone. My name is Delilah, and welcome to What the Health Confessions of a Black Nurse. I'm your host, and I've been a nurse for over 20 years. I practice bedside nursing, clinical nursing. I've been in critical care, home health, hospice, long-term care, been a health entrepreneur. So I've covered a wide array of different types of nursing practice. Now I currently work as a functional medicine provider. I'm a certified functional medicine practitioner with a virtual practice called the Holistic Health Quest. I'm also known as the Healthcare Navigator because I do help people navigate their health and navigate healthcare systems to get better patient outcomes for themselves. And today I'm going to be bringing you real talk about the healthcare system and your health journey. Today we're getting into something that's been weighing on my heart and mind a lot lately, and that is the state of healthcare today and why it seems like it's failing more patients than ever before. You know the feeling, rushed appointments, feeling like just another number, or spending more time worrying about the bills or the insurance or how much your actual health care is going to cost. Sometimes you're paying more attention to that than your actual health. So I want to get into this and unpack this feeling that so many Americans have. First off, I want you to know this isn't your experience. This isn't just your experience. This is a common complaint that the whole system has heard because the whole healthcare system is under tremendous pressure because of staffing shortages, because of burnout and trauma from the pandemic. That's left a lot of hospitals and clinics stretched very thin. A lot of practitioners, doctors, and nurses chose to walk away from the profession after COVID just because for their own health and mental health sakes. They're juggling mountains of paperwork. I used to say all the time when I was practicing that I could see double the amount of patients if I did not have to do all this paperwork. It seems like the paperwork is never ending in healthcare. Unfortunately, we have to chart everything because we also live in the day of lawsuits and malpractice and everybody suing everyone for things which were a lot of times a risk of a procedure, nothing intentional, not an error. But that is why we have so much charting because the saying in healthcare is if it's not documented, you didn't do it. So that pulls them away from what really matters, and that's spending time with the patients, getting to know the patient, and caring for the patient. When the people providing care are worn out and overwhelmed, it shows in the quality of care, no matter how skilled they are. Because if you're stressed out, if you're burned out, if you're overworked, you are not at your best. You're not practicing at your best. Not intentionally, it's just what it is. According to the Gallup News, the public's perception of the U.S. healthcare system is largely negative, with a significant portion of Americans expressing concerns about the quality, coverage, and cost of healthcare. Many believe the system has a major problem or problems or is in a state of crisis, and the trust in the healthcare system has declined in recent years. So, we're going to get into a little bit more of a detailed breakdown of exactly why people feel the way they do or have the negative perceptions of the US healthcare system. First of all, is we're going to talk about the quality. Fewer Americans rate the quality of healthcare as excellent or good, with a decline to 44% in a recent survey, down from 54% in 2020, according to the Gallup News. Another thing that is very negative about our system is the cost to get care. Even more Americans view healthcare coverage negatively, with only 28% rating it as excellent or good, according to the Gallup News. And unfortunately, that causes people to put off taking care of themselves or finding out what's going on with their bodies because they don't feel like they're going to get the care they need anyway. A large percentage of Americans are concerned about the cost of health care and expect it to become even less affordable than it is now, according to a KFF poll. Trust is gone. A majority of Americans don't trust the healthcare system. A recent poll showed that only 40% hold a favorable view, according to the advisory board, which is very sad, unfortunately. There's also system problems. A significant portion of Americans believe that the system is in crisis and does have major problems because of the high cost. The cost of health care, including premiums, deductibles, out of pocket expenses, is a major concern. The cost of drugs, treatments, tests, all those things are increasing, and it's very difficult to figure out how much your healthcare or using the healthcare system is going to cost you because the cost of things is not very transparent. Access issues. Many Americans struggle to access healthcare in a timely manner or in an affordable manner, including getting to appointments, finding specialists, or affording necessary treatments or tests. The lack of trust factors like lack of transparency, perceived inefficiencies, and negative experiences with the system contribute to a declining trust. And I'm just going to share something with you about an experience that I felt was extremely negative. I was in the emergency room with my husband because I took him to the emergency room because he was having somewhat of an anaphylactic reaction to cashews. And we get to the ER. First of all, it's very hard to find the entrance because the hospital was semi under construction. But once we get in the ER, this was during COVID time. So my husband can barely breathe. He has all this congestion just running out of his nose. And they're like, put on a mask, put on a mask. And he can barely talk or breathe. And all they're concerned about is him putting on a mask. And they're trying to shove a clipboard in his face. So I run into the waiting room after parking the car and I see this interaction going on and I just cut into the nurse. He cannot breathe. He is not going to fill out this paperwork. He cannot breathe. I do not have a problem calling 911 from another hospital's emergency room. He needs to be seen now. So she gives me the clipboard, tells me to put his name on it, and takes us straight back. So we get back there. I'm sure a few people heard our interaction, and they pretty much came into the room to see him right away. They ordered some labs, and they gave him some Benadryl and a steroid. But when they came in to draw the labs, I asked, what labs are you going to draw? Because I did not hear the doctor say that he was drawing any labs. So the nurse tells me, oh, we're just drawing labs. This normal standard labs that we get on everybody who comes in the ER. And that really was not an answer to my question. I asked what labs specifically are being drawn. So she tells me CBC, CMP, this is the typical standard labs, but she also had a extra vial then. Because I know what vials you need for what labs. And I said, so what's the extra vial for? Oh, well, we always draw an extra vial in case the doctor decides he wants another lab after seeing the results. I said, well, can we not do the extra because we're going to get charged for those supplies and things and you may not ever use them. And you also can't explain to me what happens to that vial if he doesn't use it. You guys aren't going to give it back to us when you leave. You can't put it back into his body. But like, what is the hospital doing with that blood? I kind of refuse to believe that it's all just thrown away. Of course, I couldn't get an answer to any of these questions. During this process, my husband has now passed out. He's asleep on the bed because they given him IV Benadryl and a steroid. His he has oxygen on. His breathing is better, things like that. So they bring me in his paperwork, not discharge paperwork, but kind of like the agreement to treat. So I would say ER admission paperwork. And she brings it to me to sign. They never asked who I was. They don't know that I'm his wife. They probably figured that out, but they didn't know. They never asked. They wanted him to sign paperwork when he's like damn near knocked out. They're waking him up to sign this paperwork. And I'm like, I can sign the paperwork. I'm his wife. I can sign the paperwork. So because I was doing nothing, we rushed out of the house. I decided to actually read through the paperwork. I found out that extra vial of blood in the paperwork, the hospital can keep, do any kind of testing on that they want. If they find something in the blood or anything, or if you have like special cells that they want to investigate or look at closer, they can without your consent and without notifying you of anything. I was like, oh my God, I've never read this. And so, of course, I did not let them, I was very happy I didn't let them draw that extra vial. And so I did sign everything, but I asked them, can I have a copy of this paperwork that I'm signing? And they said, yes, it'll be in your electronic medical record. And I was like, no, it's not in the electronic medical record. I set up people's electronic medical records and go through them all the time in many different systems. I've used many different systems and I've set up many different systems. I know how to navigate an electronic medical record, and it does not have the actual paperwork that you sign. It has like policies, like this is the privacy policy, this is the consent to treat policy, but it doesn't have the actual paperwork that I was initialing and that I signed. And that is what I wanted. No one in that entire ER, from the secretary to a doctor to a lab tech to a radiology tech to a nurse, not one person could figure out how to give me that paperwork and print out that paperwork, which was just absolutely disgusting to me. And in the ER, because it was under construction, which I understand, but they were still open and taking patients. So to me, patients still deserve to get the proper care and be treated just like they would if your hospital wasn't under construction. If you cannot provide that same kind of care, then your ER shouldn't be open. And I heard everything that happened in that ER. Somebody coded and died. There was a drunk person in the ER that was causing them all kind of hell and problems. I heard so many people say, I don't know where that is. I don't know where that is. I'm not sure about that, because the ER was full of traveling nurses, because this was time of COVID. So it was a shortage, but you can't run an entire hospital department with traveling staff. You have to have some type of core staff there to support them. The police came into the ER and was questioning people that they thought robbed a gas station that was a couple miles away. It was just ridiculous that I heard all of this while I'm sitting in my husband's room with him getting care. Another reason why I always suggest that you never go to a medical appointment, never go to the emergency room, and you shouldn't be hospitalized without someone being with you, because you need somebody to be paying attention to what's going on. You need somebody to be there to advocate for you, and you need to have a conversation with whoever's with you on how you expect your visit to go, so that if it doesn't go that way, even if you're not someone that's quick to speak up, they can speak up. Because the system is very complex, which is also another factor that leads to people feeling just having negative feelings about the U.S. healthcare system. It is extremely difficult to navigate. The healthcare system, including insurance, billing, procedures, it just can be frustrating because you have to talk to so many different places. You're coming in for a medical appointment, just a routine clinic appointment. And first you have to go have labs. So you're going one place for the lab, and that has to be coordinated and set up. Then your appointment has to be coordinated and set up. Sometimes people don't have their own transportation, and they have community services that are helping them get to medical appointments and things like that. So then they also have to coordinate with that. You have to call so many different places. Then you have to be sure they have your insurance information, and they want to see all that before you come because they don't want to schedule anything if your insurance isn't going to cover it. And it's just like, so it should not be that difficult and frustrating to get an appointment, to see somebody, to figure out what's going on with your health, or to help you manage a chronic condition. That is like insanity. You shouldn't have to go through all those steps, which is why a lot of people avoid going to the doctor and they end up in the emergency room. There's also many inequities in the United States healthcare system. There are tons of Americans that just do not have health insurance, or they are underinsured, which causes them inability at times to access and get quality healthcare. And it's because a lot of things. It can be because of where you live. If you live in a rural area, there may not be as many clinics. You may not be as close to a hospital. So that limits your abilities. But there's just too many uninsured and underinsured. And I don't want to get really political on here. Is at least not about some things, but there are people who come to our country that are migrants, and they need assistance. And I'm all for helping those that need help. But with having so many Americans uninsured or underinsured, which is driving up the cost of our healthcare, to just give anyone who comes into the country that needs our assistance free healthcare is a little bit backwards to me. I'm just going to leave it at that. Between 2001 and 2020, majorities ranging from 52% to 62% rated the U.S. healthcare quality positively. Now, that was up until 2020. After 2020, 54% say it's only fair, 54% say it's good. 38% say it's fair, and 16% say it is poor. That was on a case-by-case basis throughout a 24-year trend. Americans rate healthcare coverage in U.S. even more negatively than they rate the quality. So, 64% wish healthcare providers took more time to understand them. 40% say there are times when they are afraid to speak up. So those are two serious things. If you wish your provider took more care with you, part of the problem is hospital systems, every part of healthcare is reimbursed on volume, not value. So they don't care as much about whether your physician or practitioner is having positive outcomes with their patients. They're more concerned about how many patients does he see in a day, in a week, in a month, whatever. And so that's how come providers don't have a lot of time to sit with patients and actually get to know them and get to understand their situation and how they're struggling with a disease or a certain condition. If you're not happy with the quality of care you get when you go to see your doctor, then I would look for a new doctor, because we pay a lot of money for healthcare. So we should be getting the care we want. Uh, if you are afraid to speak to your doctor, then you have the wrong doctor. You have to find another doctor. You have to find a doctor that you are comfortable talking with, comfortable with asking questions, comfortable with his healthcare beliefs. Like, his healthcare beliefs need to line up with your beliefs. If you are more a traditional medicine person, meaning you just follow the typical US healthcare system, Western medicine system, then you should have a doctor that lines up with that belief, or a practitioner that lines up with that belief. If you do not, the things that he's going to recommend are not going to line up with what you want. If you want a more holistic approach to healthcare, then you really want a DO or a functional medicine practitioner, or or an integrative medicine practitioner. You need one of those. Integrative medicine technicians, they use conventional medicine and functional medicine in their practice to treat their patients. A conventional doctor, he only uses traditional Western medicine, prescribes medication, symptom manage, that kind of thing. But they don't really treat the root cause of whatever is going on with you. If you want a functional medicine practitioner or physician, that's what I am. We strictly focus on a holistic approach. We look at the whole body. We are not trying to treat your symptoms. We're trying to treat what is causing your symptoms. So that, because if we treat that, then all your symptoms go away. Some do it with medication, some do it without, some do it with supplements and things like that. Some do not. It's you just have to find the one that is right for you. Because you have to be able to communicate with your provider. You just have to, and you have to be satisfied that you're actually going to be heard, and what you go to the doctor for is actually going to be addressed. Because if you don't, like, why are you there? That makes like no sense whatsoever. So, yeah. From your perspective, and when I say your perspective, I'm saying the patient perspective. From the patient perspective, I get it. I get it because I have also been a patient. I've had 3 children. I had heart surgery when I was a child. I've had, certain little things on and off that either required a inpatient stay or a same day procedure or something like that. So I've been on the patient side too. You walk in needing answers or support, and you leave feeling unheard, maybe even discouraged, which is completely opposite of the reason that you went to that appointment. If we go to a restaurant and order a meal, I order steak and they bring me chicken. Well, that's not what I ordered. I'm going to send it back, or I'm going to just say, no, take this off the bill because this is not what I ordered. Please bring me what I ordered. If they don't do that, I'm not going to pay for chicken that I didn't order. It's taking off the bill or refunded or, corrected. It's no different when you go to the doctor, except you don't get your money back, but you are paying a significant amount of money at the doctor. You should not be leaving the appointment if what you went there was not addressed. You should not be leaving the appointment with more questions than you had when you got there. If that is the case, you are seeing the wrong doctor, or you need to probably reach out to a social worker or a health coach or a patient care advocate, so that they can help you find a doctor that you can communicate with, because there's no way you're going to fight a chronic illness or stay in front of your chronic illness to prevent further decline or further trauma to your body. There's no way you can do that if that's how you feel when you come out of a doctor's appointment. Same thing with mental health. So many people have mental health problems that are often ignored or under supported. And I think that's part of why people don't like to speak up. Also, I believe we're overdiagnosed, meaning I can have heartburn one day, and if I say that at the doctor, now I have gastrointestinal reflux disease, like GERD. Like, that's ridiculous. I said I had heartburn one time. That does not mean I have a disease now. So sometimes I think people are hesitant to bring up mental health things, but even when they are, it sometimes seems like they're having to try to convince people that this is what's going on with them, because their provider may not understand or relate. And once again, they walk out ignored or undersupported, which we are seeing play out in people's actions, unfortunately, on a daily basis across the country when we watch the news. Skyrocketing insurance costs. Everything is expensive in the United States now, everything. And I have a feeling it's going to get worse before it gets better. And so the last thing you want is a bill that is astronomical because you went to the doctor to get care. Most people can't afford another bill. A lot of people can't even afford their prescriptions or whatever the treatment may be if they go see the doctor because of what their copay is or deductible is or whatever, whether they have insurance or not. Even with insurance, sometimes it's actually cheaper to ask your physician what the self-pay rate is because it's actually cheaper than most insurance cost. So I do want to make sure everybody understands what the U.S. healthcare system refers to, or what is all included in that network of interconnected entities and processes involved in providing healthcare services to the population of the United States. So that includes providers. Providers are doctors, specialists, physician's assistants, nurse practitioners, functional medicine practitioners, nurses. Those are all providers. Payers are insurance companies or government programs like Medicaid, Medicare, CHIP, TRICARE. TRICARE is the veterans insurance that is controlled by the government, kind of like Medicare, but it's specifically for veterans. Medical suppliers are also part of this system. So they're the ones that supply all these different healthcare facilities, and they a lot of times are supplying the patients inside their homes as well. Policymakers and regulators are part of the healthcare system. Regulators like CMS, or Center for Medicare and Medicaid Services, the FDA, the Food and Drug Administration, state licensing boards. Every discipline that practices in healthcare has a medical licensing board that is guides or, in a sense, creates the rules for our practice. Surgeons have them, physicians have them, nurse practitioners, registered nurses, physician's assistants, but you know what I'm saying. Anyone who's a provider has a state medical licensing board. Professional stakeholders would be like the American Hospital Association, research institutes, but all these different organizations that have a stake in the healthcare system. So any association or group that has stake in the healthcare system to keep their group alive. Research institutes, like I said, pharmacies and pharmaceutical companies are also part of the US healthcare system. And the most important part of the system is the patient or the consumer. For the American population, coordinating and managing healthcare is overwhelming and time consuming. Not only are US adults spending on average one working day per month coordinating care for themselves or their loved ones, but nearly 3 in 4 US adults report that in one way or another, the healthcare system is failing to meet their needs. The cost of the care and the time spent waiting for appointments are the common factors contributing to patient dissatisfaction within most healthcare systems. These are systemic problems, but it really does go even deeper than that. With a healthcare model that rewards volume over value, like I said, seeing as many patients as possible or a high number of patients or surgeries, things like that. Doctors rush, they order multiple tests and labs that may not necessarily be necessary, and no one sees the big picture or is putting all the pieces together to help you with your health. Because we do struggle with the affordability, we delay or even just forego necessary care due to cost. Like we see all these campaigns for early prevention, and some of the things that are preventative based off your insurance may not cost a thing. But if you're underinsured or don't have insurance, then you have to pay for those. And so you may forego your mammogram even though you need it. You may forego a colonoscopy even though you need it. You may forego a procedure that would help your back or help you not be in so much pain or things like that. But because of the cost, if something has to give, a lot of times it's those tests that we need to stay preventative and in front of a lot of chronic conditions or terminal illnesses. Medicine often too is focusing on treating symptoms instead of digging into the root cause. Now, functional medicine providers and some DOs, they are into that's what we do. We dig into the root cause. We are not necessarily treating the symptoms that you're feeling from a chronic illness. We're actually figuring out why you have that illness. But by treating the symptoms, patients are bearing the brunt of that. And because it sets you up to keep having to go to the doctor. If you're working with a functional medicine provider or a different type of provider that is focusing more on your root cause, they are reversing your diabetes or they are reversing your hypertension instead of giving you medication to treat the abnormal numbers. I want to know, why did your hypertension start anyway? I'm not as concerned about the number. Of course, the number has to be treated if it's too high, but I'm doing a deep dive into your health, a deep dive into your life to see why did this heart condition develop in the first place, and let's treat that. So then he doesn't have to worry about hypertension at all, instead of every time the number starts to go up because your medication isn't working anymore, you go back to your conventional doctor and they either add another medication or they increase the dose to address the number that he sees. And also, if you're not checking things like your blood pressure at home, when you go to the doctor, unfortunately, they can check it like 2 or 3 times while you're there. But unfortunately, they're making decisions based off of that number in front of them. They're comparing it to other readings from the past. They're looking at that one. If you were checking at home, which is your normal environment, they can see a clearer pattern and also provide more specific care. So, the key problems: rising healthcare costs, access to care because of disparities or living in rural areas or limited ability to receive necessary medical attention for whatever reason. because of workforce shortages in healthcare. Healthcare professionals, doctors, nurses, specialists, surgeons, the strain on the system, and the impact of the quality of care. Quite frankly, doctors and nurses and healthcare professionals are retiring faster than people are graduating to take their jobs. When I started practicing in 2004, I got a $15,000 sign-on bonus because of the nursing shortage. But I know they don't offer, some places may, but I don't know how frequently other businesses now offer that. But like everywhere was offering a sign-on bonus because they're all competing for a small group of people. So yeah, and that's good, the case for doctors everywhere. And it's going to significantly impact care. Patient safety. A lot of people are just scared to go to the doctor because of medical errors, preventable adverse events that pose serious threats to patients' well-being. They don't feel like they're going to get quality of care. They're not going to get the help they need to manage their chronic diseases. They're not communicating effectively to work together as a team to coordinate and impact it. And then the financial challenges because of payer denials, low reimbursement, staffing needs contribute to financial instability because you have to pay staff, you have to have staff to pay. And that impacts their ability because a lot of hospitals or rehabs or nursing homes, when they don't have staff, they bring in, and they have to meet regulations, they bring in traveling nurses, traveling doctors, traveling specialists, but they cost much, much more than someone who lives in the community that's working there. Regulatory changes. The ever-changing landscape of healthcare regulations adds complexity and administrative burdens as well for healthcare providers. And we're seeing a lot of regulatory changes and things changing right now with the current presidency, with the CDC and Department of Health Services and CMS, Center for Medicaid and Medicare Services. They're going through a lot of change right now, and unfortunately, that is also going to impact the patient. Technology is helping, like electronic health records. It's easier for patients to share information with different physicians that may not be in the same health system or in the same building, but it also can be difficult to use sometimes. There's no transparency on pricing, so it makes it very difficult for a patient to decide whether they should or shouldn't because they're not necessarily given all the information they need to make an informed decision about their care. Healthcare workers are burned out, exacerbated. We're still feeling the effects of the pandemic, and that's just like pushed a lot of healthcare workers out. The payment models and how places that deliver healthcare are reimbursed, it really has to change. It makes it too complex for the patient. Doctors and practitioners are losing their autonomy because they may recommend a treatment for you that your insurance doesn't cover. There is another treatment he can do, but he doesn't feel that that's the best treatment, but your insurance company will cover the lesser of the two. So it's kind of like his hand was forced in regards to the treatment options. So, and limited primary care and preventative care. People used to have the same doctor from birth to death. Like there was a family doctor. Everybody saw him. Everybody knew that doctor very well. Kind of like he would be a community doctor. Just because you had high blood pressure, he didn't send you off to a cardiologist, or just because you have diabetes, he doesn't send you off to a endocrinologist. He manages those things until they get above his skill level, and then he may bring a specialist in. But because of the lack of primary care being delivered that way anymore, it's really caused a lack of focus, and things just fall through the cracks, because I know patients believe their doctors are communicating with each other, but they are not. And when you're not going to a primary care, or you're not being taught how to prevent things to minimize your risks for a lot of common chronic conditions like heart disease, hypertension, diabetes, those things can all be prevented. But if you're not taught that, that's not going to happen. And unfortunately, our healthcare system does not teach prevention. The population is aging. The increasing number of older adults requires more healthcare resources and services, putting additional strain on the system. Yeah, people are living longer with chronic health conditions. And as you age, if you're not making the necessary preventative measures or lifestyle changes, you can be in and out of the hospital quite a bit, or you have to go to the doctor much more frequently, or you're paying much more money for medications, because as you age, chronic diseases like heart disease, diabetes, they require ongoing management. And unless you work with some type of holistic health, you're not going to be able to turn that disease around. Factors like poverty, lack of education, limited access to transportation, all of this is impacting a person's health and access to care. Addressing these systemic problems requires a multifaceted approach that involves policy change, technology innovation, and renewed focus on patient-centered care. Here's the real talk. You can push back. Knowing your health, asking questions, and seeking out practitioners who see you as a person, not as a number, and they cater their treatment towards you, not a standardized treatment for everybody that comes through their office with the same disease. That is your power. The more you know your health, are prepared for medical visits, ask the appropriate questions when you're at a visit, take someone with you so that, two people are hearing everything. You have to be proactive, because if you want a good experience when you go to the doctors, you can create that, but you have to play your part too. That's why I'm here at What the Health. I'm committed to helping you navigate the system, find holistic care, provide holistic care, and help you advocate for yourself every step of the way. A lot of these experiences that happen to some people at the doctor, they never happen to other people, because I don't allow, like me personally, I don't allow them to happen to me. I know what I'm going to the doctor for. I know what questions I have ahead of time. If there's questions that are going to require maybe a little digging, I'll send the questions to my doctor ahead of time. You know what I'm saying? If it's a really, really important appointment, or I'm not feeling my best, I'll ask my husband to come along so that he's hearing everything too. And so as the patient, you have to do your part to make your experience with the U.S. healthcare system as positive as it can be, because unfortunately, it's not going anywhere anytime soon. Thank you again. Bye for now from Delilah, the Healthcare Navigator.